And well, as you see, do you see? Yes, you should see.
Yes, ma'am.
Good. So we continue speaking about giving instructions and describing procedures. And this is unit 3 in the book. And I would also ask, I don't know, do you have the book, the electronic version of the book? Bless you. So
Yes, ma'am.
yes, you have the book,
Yes,
right?
ma'am.
Okay, so you found it on the internet, right? Yes, sure. Where did you get it?
Yes, ma'am. Yes, ma'am. I think I get from universe system.
I see. Anyway, so I mean that
Yeah.
you can share the book with your group mates, right?
Okay, ma'am. Okay. Okay.
Thank you. And I mean that. So first, I would like to congratulate you with on getting certificate for online course that we studied English for healthcare. So this is the certificate which is available on futurelearn.com platform. And those students who were curious just got the certificate and just sent the certificate to me if you haven't done it yet. So you know that the certificate is available on the site and you can just download it and just you'll be able to demonstrate it to anyone who is interested. And
Excuse me, ma'am.
Yes.
I'm in my system, ma'am. Week 5th is not open. Ma'am, after 4th week it will stop and it will not show like to enter in week 5th.
It was available for 5 weeks, right?
Yeah, ma'am. But week 5 is not available in my edition. Like it is not open for me.
So and you haven't downloaded the certificate, right?
Yes, ma'am.
If you try to enroll in the course one more time with the same login, did you try to do this?
Yeah, ma'am. I try again, ma'am.
Ma'am,
4 or
after
5 times.
week 4, we will get the certificate.
Sorry?
After the week 4, ma'am, we saying that we will get the certificate. Not before that.
There is no week 5.
There's no week.
Okay.
So I mean, please, if you can recommend show up anything in this situation, please contact him. Just solve this issue, okay? Because I don't know really how to deal with it.
Ma'am, there is also written in certificate 4 weeks, 3 hours per week.
Yes.
There are.
Okay. Well,
Mummy.
Let's go on and so well, let us focus on the test that you've done. And I think, okay, are you happy with the final score for midterm 1?
Yes, ma'am.
Everyone. So because all of you have excellent rating, right? Yes, almost all of you. Okay, yes. So but anyway, there were some questions in the test that were hard to deal with, and some of the students got just about half of the maximum score, and most of the students just about 2/3 of the score. That is why I would like to focus on some questions that seems to be hard to answer. And you remember that there were several questions, like several tasks, like giving definitions or using some words, the name of the jobs, the names of the jobs in the context. Like here in this sentence, we have an important link between hospitals, general practitioners, and other health professionals involved in antenatal care is there. So the key word here is antenatal care. And that is why, so here students have chosen receptionist, it's wrong. So midwife. So we should, yes, so we should understand this. And that is midwife, the correct answer here, correct option. As for the next slide here, if we have a look at the task, the question is the sentence correct? And we were speaking about this sentence at one of our classes. Doctors in urban areas are usually more educated than in rural areas. So
false.
Because of
Because they both get the same education, and sometimes the doctors who are educated from the urban areas, they go to the rural areas.
But I mean that this is this is the sentence which was taken from one of your essays, and a lot of students just wrote about this. It means that you've found this fact somewhere on the internet, and so the meaning of the sentence is true, but what is wrong in the sentence?
Rural and urban area doctors have same amount of education.
Education is same.
It is same.
It is not about. It is not
Only
about.
difference is that
Clinical exposure is different.
yes, clinical
Yes.
exposure.
Yeah, ma'am.
The circumstances are different.
That's what
So,
clinical exposure.
have a look at then. So it shouldn't be then, it should be then. Yes, when we compare two ideas, it should be A here. That is why we answer the question, the sentence is not correct. Yes, this is false. So do you see? Instead of then, we should
Grammatical mistakes. Yes, ma'am.
Yes,
Okay, ma'am.
so the next is also about medical jobs. This is a practice is run by
Practice manager. Practice manager.
yes, of course, this is practice manager, because practice manager organizes all the process, and is run here has the meaning of organizes the process and organizes everything in the office, in the hospital. So it should be practice manager. And he supervises also. And well, the next is somebody needs very good interpersonal skills, because they are the first
Ma'am, receptionist.
The key idea is the first contact people have with the practice.
Receptionist.
Yes, sure. And the next is so the next set of examples from the test are about grammar structure and about the grammar tense that we should use in the sentences. Like this, one of them is here. First, I, the history from Mrs. Simons, then I, her. So here the student marked have taken and have examined, and this is
First I took.
Second option.
Yeah, examined. Took and examined. Second
Yes.
one.
yes.
Both past.
Why should we?
B. It will be B.
It should be B. Yes. Okay. It should be B, because we have succession of actions. First, we speak about one action, and then exactly after the first, we have the second action. This is the succession of action in this case, we should use the past simple tense. Even if we don't mention the time, even if we don't speak about the time. Okay, then it's not available at the moment. Here, the case notes to make sure they are up to date. Well, is checking, of course, because we have the phrase at the moment, which is the time marker. Or what tense? What is the name of this tense?
Continuous.
Present
Continuous.
continuous.
Present continuous.
Exactly. Okay. Well, and the next is my children with the GP practice last year, but I with them longer. So we have the time marker last year. It means that we need to use
Have registered. Have registered.
no. If we
I register. First
know,
register and have been
Registered.
registered.
registered
Have registered.
Registered
Yeah.
and have registered.
Have registered.
and
Only
have
been
registered, yes.
Should be D.
So this
Have
is
registered.
which option?
Ma'am, C. Sorry.
Ma'am,
D.
D.
D option.
No, it should be not B,
Okay.
because here
Why is
D.
it the first
D.
one wrong?
D,
Ma'am,
option,
D.
D, of course. My children registered, but I have been registered. This is also the
Have been.
passive voice.
Past tense.
And yes, because there is no information about the time when I registered. Yes, we know only about the children.
Ma'am, why the first option is wrong?
The
My
fourth
children
option-
have registered with the GP practice last year, but I have been registered with them longer. Why is it wrong?
So the fourth
First one.
or the
Because
first?
I marked it. First one, A option, yeah.
A option. Why is it wrong? Because there is information about when the action happened. It happened last year. And the rule is if we know the time of the action, we should use the past simple tense. So like here in the option registered. Well, and if we move on. So my last class for the day. I'm going home now.
I have taught.
I have taught.
Have to.
Exactly, yes. Option A should be used here because we speak about the finished action. So the action was finished and so I am free and I'm going home now. So have taught. This is the right option here. Okay, and yes. So do you have any more questions about the test? Something which you didn't understand or you would like to discuss?
Ma'am, do we have to submit? Ma'am, do we have to submit that certificate somewhere? The final certificate which you have told us.
The final what?
Certificate, ma'am, of the future learning course.
Certificate.
course.
You joined later,
Yeah.
right?
Ma'am, where?
Certificate.
Ma'am, I joined the 10 minutes after.
So I mean, we discussed this whether you can get the certificate. Some of the students just got the certificates after they have finished the course, the fourth week, and then they could get the certificate on the site. If you haven't
So we have to upload it somewhere.
So no. So you don't need to upload the certificate on Moodle. Just this is for you because I see that you've done all 4 weeks, and so we've done with the course, and I don't need any evidence that you've done this. Do you see? Is it clear?
Okay.
Mm-hmm. Well, and so. Let us go on with our instructions and procedures, Unit 3, which we are going to discuss today. And you remember that we started speaking about giving instructions the last class. And so anyway, you understand that when we give instructions to somebody, the imperative form should be used. And the imperative form of the verb is used for giving very clear and direct instructions. And this form does not sound impolite here, as each command forms a step which is part of an accepted procedure that is learned like a formula. So the person receiving the instruction will perhaps pass on the steps to someone else as part of their teaching. If we teach somebody how to make some kind of procedure, so we give short and clear instructions. And the examples are given here. We should use like infinitive, the imperative mood. This is the infinitive without particle to, and the example is complete the drug charts. If it is a negative form, we use do not, don't forget to complete the drug charts. Or we can add the adverbs, which are also possible in imperative mood, like here, always complete the drug charts. So, and another way of giving instructions is the use of the present simple tense and the pronoun you. So this form is used for describing steps in a procedure. The example is, you wash your hands, then you put on gloves. Also, we can use the adverbs in here with the present simple, like in the example, you clean the area thoroughly. And if it is we should use a negative instruction, we use do. So you don't need to put the instruments away yet. So this is the use of the present simple tense. Well, let's have a look at this slide. Here we can see the picture that illustrates the IM injection, and yes, intramuscular injection, and we should think about how to what kind of instruction should we give for the procedure. So the short instructions that our colleague can follow, like teach somebody how to do the IM injection. Who can do this? What will be the first phrase, the first instruction, the first step?
Ma'am,
Yes.
Wash your hands and put on the gloves.
Ma'am, yeah. The first thing is wash your hand and put the glove.
Okay, then.
Make the
Ma'am,
patient
then sterile the hand,
be
sterile
in
our
a
hands
prone
and the
position.
area, ma'am, in which we inject the injection.
Then.
Um,
Ma'am, then prepare the injection.
With alcohol. Sterilize the area and then do the intermuscular injection.
Okay.
Now, after giving the injection, we have to press the site of the injection with some pressure so that bleeding doesn't. After the
Okay.
patient press,
you should not rub that area.
Muscular
just
injection
press.
should not rub the area.
Yes.
Ma'am, first of all, you should ask the patient to lie straight and do not actually constrict the area wherever we are giving muscular injection. We should advise the patient. Then we should actually thoroughly clean the area, sterilize the area, and then we should actually insert the needle and pull the plungers toward ourselves so that we can check that there's no blood inside the syringe. That's the main rule for intramuscular injection. And after that, we'll slowly induce the injecting material, whatever medicine we are using, and then slowly take out the needle. It is advised that you should stretch the skin at the area. I mean, we can write the postscriptum as well. Postscriptum, in which we can advise the patient to actually, the doctor to actually stretch the area so that the needle goes slightly inclined and there isn't actual straight passage for the escape of drugs. because whenever we are giving muscular injection, there are chances that the drug may pass out from the hole which is created by the needle. That's why we advised to actually stretch the area and cause an inclined aeration for the inclined canal for the aeration.
I see. Thank you so much, because so I didn't know about this. I mean, that you are experts in all this kind of procedure, and you've given the instructions, and you've also commented on the instructions, right? And the example of such kind of instructions are given here on this slide. So they are short and they are used in imperative mood.
Yeah.
So wash, gather, locate, clean, prepare syringe with medication, inject the medication with the syringe, remove the needle, and of course we should add what Priyesh was speaking
Pressing.
about. Yes, yes. Nishat?
I'm pressing on the point where we have given the injection.
Yes, you're right. Thank you. Well, so if we speak about the procedure of giving instructions, so this is very important for any doctors and medical staff. And so now we are going to read the article about the so-called DOPS. These letters stand for Direct Observation of Procedural Skills. So this is the process which was organized by the Royal College of Physicians in the United Kingdom, and you can see the beautiful logo of this college. And we can understand that this college deals with the healthcare, right? And so these are the procedures. So this is that were developed to check the doctor's ability to make something, yes, to do some procedures. Now, before we start reading, so I would like you to have a look at this slide, and here, so we should choose. We have the verbs to the left in the column: provide, undertake, assess, identify, administer, seek, consider. And there are 4 nouns on each line. And so keeping in mind that the text that we are going to read describes the practical procedures. So DOP, direct observation of procedural skills. So the trainee doctors are in the United Kingdom are assessed about these procedures. So keeping in mind this fact that the text is about assessment, let us try to find, to guess the phrases, the collocations which will be used in the article. So the first one is for Aman. So what do you choose?
Yes, ma'am. Ma'am, provide therapy.
If we speak about assessment, evaluation, about control.
Ma'am, there should be we should provide the feedback about the food and information data.
Information data, also possible. Yes, it's not easy to guess. But if we speak about, for example, what we did today about the midterm test, you were provided what?
Ma'am, feedback is the noun here. Feedback is the verb here.
The feedback, right?
Yes, it is a verb here.
I see. Okay. Well, the next line is for Apeksha, please. Number 2.
Yes, ma'am. Undertake survey, because it is given as a practical docs. For anything which is related to practical is surveys.
And if we understand the meaning of the letters DOPS,
DOPS means direct observation of a procedural skills.
Mhm.
Direct observation occurs when some procedure is taken, like a practical thing is going on. For that, surveys is something which is done practically and not like theoretical.
Okay,
So I
okay.
guess
So anyway, the trainee doctors, they undertake procedures, right? So then the next is for Misha.
yes, ma'am. We have to assess in the theory.
Theory. Mhm. And if we speak about practical skills,
Then
they
in
do not
competence.
competence. Mhm. Thank you. So the fourth is for Nivas. Or
Yeah.
yes.
Yeah, then we have to identify the patient and diagnose him or her, diagnose him that from which disease he is suffering.
Identify patients. So
Yeah,
if we
and
speak about ability, doctor's ability to do something, some practical, some procedures. So the people who assess them, they identify doctors'
strength.
strengths, maybe. Mhm.
Yeah.
Well, thank you, Vandana.
Yes, ma'am.
Next, please.
Administer the medications.
Mhm. Minister medications. Okay, good. Then
Thank you, ma'am.
Priyesh, please. Priyesh.
Ma'am, we should actually seek the various properties. I mean, seek the help if we need any help. Right now, whenever we are actually observing or working with the patient, there are chances that we need assistance. So you should seek assistance as well as help regarding the case and all.
Help from the patient or what?
No, ma'am, not from patient, from your helpers. I mean, whatever, if nurse is required, nurse, if ward boy is required, ward boy, if a porter is required, then porter. It depends on the case as well as the situation.
Yes. Anyway, so this is the team
Yeah.
work created by.
Because works are divided into a hierarchy. Doctors can't do everything. Doctors can't go and clean the stuff. So there are chances that there are people who will do it. So we should actually seek their help. I mean, their assistance over here. Seeking assistance is the key.
Great. Thank you. And the next line is for Yeda Frakhav. Are you here? Frakhav.
Consider the link's age and region first. Consider the link's age of regions first.
Consider, so connection is bad. You say feelings, yes? Okay. Let us, good, thank you. Let us have a look at the next slide, and here we have the answer, like the phrases which will help us to understand the article. And yes. Now let us have a look at the article itself. And before we start reading, I would like you to look at the words, the definitions are given here. For the words for trainee. So when we speak about training, there are just two groups of people involved: those who train and the trainees. A trainee is a person undergoing training for a particular job or profession here in this context. And encounter, here it has the meaning of meeting or session. Encounter. Well, so let us listen to somebody to read the first part. Let us listen to Jval, please. Read it.
Ma'am, DOPS, direct observation of procedural skills. DOPS is designed to provide feedback on procedural skills essential to the provision of good clinical care. Trainees will be asked to undertake 4 to 6 observed encounters or procedures during the year with a different observer for each encounter. The assessors include, among other experienced specialists, appropriate nursing staff or consultants in a secondary care setting. The estimated time taken by each procedure is 20 minutes. That is 15 minutes for the assessment and 5 minutes for the feedback.
Mhm. Well, I think I have a question. Do we understand the meaning of the phrase in a secondary care setting? Why? What kind of setting is it? What kind of care, secondary care is it? Why is it called secondary? Yes.
Maybe after the treatment.
After surgeries or
After surgery. Mhm.
The care taken after the primary procedure is being done. So any primary procedure includes like any operations or maybe any other, like a patient is
that's what
being burned.
surgeries.
A burn patient comes to the hospital. After the treatment of the burns is taken care, then the secondary procedure comes, where is the nurses take care of the monitors and other stuff. In short.
Okay. I see. Okay. So we do understand this. And yes, the rest is clear, I think. And if we move to the next slide here, we should listen to Sayunika.
So
Yes.
each DOPS should represent a different procedure, and trainees should choose from each of the core problem groups identified in the F2 curriculum. By the end of the year curriculum, the trainee chooses the timing and procedure and absorber.
Mhm. Well, so we know the meaning of curriculum is like plan, right? And here we have the F2. F2 here stands for foundation program. Foundation, like the second year, as we have F2, the second year of instructions. Well, and good. The next person to read will be Rohit. Rohit, hello. No, Rohit.
No, he was not here. He has a fever. No, he has fever today.
I'm so sorry. Now, Ritik, please. Ritik? No, Ritik, he was there. So, Schweib,
Yes, ma'am.
read it, please.
It is essential that all trainees should be adequately assessed for competence in the practical procedure that they undertaken, and directly observed procedural skills like which we call it DOPs is a method that has been designed specifically for the assessment of practical skill and was originally developed and evaluated by the RCP. And in keeping with the foundation program, quality improvement assessment model, strength and areas for the development should be identified following each POP's encounter.
Good. Do we remember what the letters RCP stand for? This is the name of the institution that was mentioned before we start reading the article.
Royal College.
Yes, this is
Royal College Procedure.
this is
Royal College Physician.
of physicians, right? Okay. Well, and yes, and the next piece of information is okay. So let's stop here because we don't have enough time. Yes, we'll continue after the break, and